This last section should be pretty short, not because there's not a lot of developmental challenges, but because I really tried to boil it down. So, first off, we've talked primarily this semester about cisgendered youth, or those whose sex matches their gender, largely because that's the area that researchers know the most about. Now, this isn't to say that that non-binary youth are unimportant, um, simply that we just know less about them. From the APA fact sheet on non binary gender identities, quote, non binary gender identity is under any gender identity that does not fall within the strict categories of contemporary Western societies, which typically consider gender to be binary, just either man or woman. Because there is limited research on individuals with non binary gender identities, it's difficult to estimate the exact number of people who fall into this category. Most research doesn't include non binary as a response category when asking about gender. We typically see male and female. It's getting a little bit better. Now you might start to see an other category, but that's few and far between. From the limited research that has assessed this area, it's estimated that non binary individuals make up 25 to 35% or more of transgendered populations. But these studies sampled only transgender populations and didn't capture non binary individuals who don't identify as transgender. So the numbers are likely not quite the same. Although most children do come to identify with their natal or birth sex, some experience gender incongruence with their birth assigned gender, and some are gender dysphoric, or they experience a sense of discomfort with their biological sex and assigned gender role. And at an early age, express dissatisfaction with their assigned gender, sometimes as early as 2 years old. Gender dysphoria usually emerges in childhood and deepens in adolescence as the individual begins to become more aware of their gender identity and starts to explore and experiment. However, less than a quarter of such children remain gender dysphoric in adolescence. Research suggests that dysphoria may be more likely to persist for children who are severely troubled by the mismatch, insist they are the other gender, and engage in high levels of other gendered behavior. In terms of mental health outcomes for transgender individuals, it's actually a pretty understudied area. From this research, it appears overall non binary people may face both greater levels of minority stress and unique forms of minority stress in compared to binary transgender peers, a factor which has been associated with higher levels of suicidality. Additionally, non binary transgender people experience greater risk for negative mental health outcomes than their binary transgendered peers. Among children, efforts to suppress or deny their identified gender is often met with heightened distress. This isn't surprising and suggests that adults should allow children to experiment with their gender without shaming, criticizing, or teasing them. Unsurprisingly, transgender individuals experience risks across the lifespan, including family rejection, social ostracism, unemployment, poverty, homelessness, depression, and suicide. So I'm sure many of you come across depression quite a bit in your work. It's a serious mental health problem that causes a persistent feeling of sadness and loss of interest in activities. Depression is the most common psychological problem affecting teens. 15 to 20% of US adolescents have had one or more major episode. Depression affects teen girls twice as much as boys, and these gender differences in rates of depression are sustained throughout the lifespan. Issues such as peer pressure, academic expectations, and changing bodies can bring about a lot of ups and downs for teens. Unfortunately, many do not receive treatment as adults often minimize depressive symptoms as just a passing phase. Teen depression can have serious consequences and often requires long term treatment. For most teens, however, depressive symptoms will ease with treatment such as medication and counseling. Depression is moderately heritable and is at least partially related to the hormonal changes of puberty. So, if you think back to earlier in the semester when we talked about gene by environment interactions, while there's some evidence of the role of nature on depression, nurture is also a factor. So, in other words, although some genetic factors may sensitize the brain to react more strongly to negative experiences, the experiences themselves are what can kick off depressive symptomology. Another major challenge of adolescence is suicide. Rates increase sharply during adolescence. While depression more heavily impacts girls, here we see boys at greater risk, perhaps because of gender role expectations and less tolerance for feelings of helplessness among males. Males also tend to choose more lethal means of suicide, like guns, while girls tend to choose things like pills, which stand a better chance of interruption or revival. There's ethnic differences. Rates are higher among African American boys and Native American youth, perhaps associated to stressors in the family environment or some of that minority or acculturative stress we talked about earlier. Sexual minority youth are also at high risk. Research has found that those in the LGBT plus community attempt suicide 3 times more often than other adolescents. There's other personality factors associated as well. Being intelligent, withdrawn, unable to meet own or other standards, antisocial, hostile, or destructive behaviors have all been linked to suicidal ideations or behaviors. Prevention and response efforts include training adults to recognize and attend to warning signs and provide support as needed. Information and access to telephone hotlines or virtual support. Schools and communities can also help by offering opportunities for supportive adult and peer relationships, particularly in situations where the teen is not getting them at home. And at the risk of getting political, gun control legislation is critical in terms of limiting access to firearms, which can be used to commit suicide. We've talked a bit about some of the factors associated with teenage delinquency, namely the development of the risk and reward system before the development of the cognitive control system. Delinquency rises over adolescence and then declines in the early 20s, perhaps as those impulse control systems catch up. There's all sorts of risk factors at the individual level, things like gender. Boys are more likely than girls to commit violent crimes. SES, ethnicity, having a difficult temperament, low intelligence, poor school performance, peer rejection can all play a role. Inept, harsh, or inconsistent parenting are often associated with delinquency, as are lack of supervision, living in poverty stricken neighborhoods, or attending poor quality schools. Researchers have identified 2 routes to adolescent delinquency. The first is early onset, where behaviors begin in childhood. So here we're talking about the kids who display aggression early on or are violent to animals. These kids, mostly boys, show some deficits in cognitive functioning, emotional self regulation, and morality development, and often go on to engage in serious antisocial activities. These tendencies tend to be visible as early as age 2 and often fade over time. But when they don't, what we see is a subsample of kids who were aggressive early on and stay highly deviant throughout adolescence. The other path is late onset. In this scenario, the antisocial problems begin around the onset of puberty. More often than not, these problems are a direct result of negative peer influences, rejection, victimization, etc. Most of them will abandon these antisocial behaviors as they enter adulthood. The struggle is that engaging in serious offenses as an adolescent can create lasting boundaries by closing off opportunities. And this is one reason that scholars like Larry Steinberg are staunchly against adolescents being tried as adults in the justice system, because criminal records established in adolescence may put someone on a path towards crime and deviance, when, if left alone or provided with adequate support, they would most likely bounce back to become a productive member of society. Unsurprisingly, there have been many attempts to prevent adolescent delinquency. The most successful of these start early and intervene on multiple levels, such as combining family intervention with positive school, work, and leisure activities. There's been a push for to these zero tolerance policies in school. We know that they're vastly ineffective. These policies aim to punish all disruptive behaviors with suspension, but are often implemented inconsistently and tend to punish the victim as well as the perpetrator. Furthermore, low SES minority students tend to bear the brunt of these consequences, placing additional stressors on an already at-risk group. Instead, effective interventions train parents and provide youth with skill building exercises, such as parental communication, monitoring, and discipline strategies. And so, while I could certainly spend much more time talking about adolescent social development, we'll leave it there for the week.